you know, my name is Jennifer Tobin, and I am the Deputy Administrator of the Natural Hazards Center here at the University of Colorado Boulder. And I'm so excited to welcome you all to this informational question and answer session for our internal continuation award call titled Extending Public Health Disaster Research and Community Engagement in the U.S. Territories. So like always, before we begin, I would like to take a moment to thank the Center for Disease Control and Prevention, as well as the National Science Foundation for generously funding this continuation call. I would also like to thank Director Lori Peak, as well as Research Associates Rachel Adams and Megan Morty for helping to administer the Public Health Research Award program that makes all of this work possible. So our funders, our partners at CDC were so very pleased with the research that came out of the first two special calls, but they also had the great insight to realize that to truly make a public health impact with these research findings, that these teams would need access to both more time and additional funding. And therefore, we partnered with CDC once again to develop this continuation award that we hope will provide additional opportunities for research teams to make the most impact in the communities that they have studied and partnered with. So we're so very proud of this program and the calls that have come before and the many ways that it's already contributed to improving public health knowledge and practice. And we look forward to what this next round of proposals will bring. And so I'd like to take a moment also to acknowledge the ongoing devastation caused by Hurricane Fiona in Puerto Rico. Our hearts go out to all of our friends and colleagues who have been affected in those areas. And we understand that many of you may be wanting to submit a continuation award proposal focused on Puerto Rico, but could not be on this call today for whatever reason. So please do reach out to us directly if you have any questions or concerns about continuing your research in Puerto Rico. Okay, let me change my slides here. Okay, so our objectives today are to provide a brief overview of both tracks 1 and track 2 of the continuation award, to offer advice and best practices for how you can construct a successful research proposal. And finally, and most importantly, we just want to hear from all of you and answer any questions that you might have in preparation for applying for this award funding. And just so you know, this meeting is being recorded, so we can post it back to our continuation award page for anyone who could not attend today in person. And then we please invite you to put your questions in the chat box as we move along so we can make sure and answer them later on in the call. And so now I'll turn it over to Rachel Adams to discuss this call in more detail.
Thank you, Jennifer. Yeah, so as Jennifer mentioned, this is a proposal that's specific to Special Call 1 and Special Call 2 of the Public Health Disaster Research Award Program. And some of the requirements for this continuation call is that applications must be led by at least one member who was part of the original project when it was initially funded. And research teams are only eligible to submit one proposal per this funding cycle. So even though there are 2 tracks, you cannot submit for both tracks. So the special continuation call will support 2 different types of research tracks. If you want to go move to the next slide, Jennifer. So track 1 proposals are focused on building on the knowledge base of your previous research projects by expanding the research through the expansion of data collection and analysis. Whereas track 2, the proposals are focused on expanding community and stakeholder engagement so that you can actually apply the knowledge that you learned from your previous research project, continue to build connections, and encourage the application and implementation of your research findings. And so we will fund between 5 and 10 awards, the amount of $10,000 to $25,000 each. And one pre-submission requirement that we have for each team is that the lead investigator must complete the Converged Public Health Implications of Hazards and Disaster Research training module. I know those who are in call 2 have already completed this, but for those of call 1 who are invited to complete it, who may not have done so yet, we do encourage you to complete that training module as it really help strengthen your proposal and will be a requirement for the lead investigator. So some key dates. So the deadline for submitting the proposal is approaching. It is due on 5 p.m. Mountain Time on Friday, October 21st, 2022. And in terms of deliverables, all track 1 award recipients must submit a 20-page double-spaced report, and all track 2 award recipients must submit a project brief summarizing the project activities and outcomes and other achievements to us by Friday, March 31st. So from the time that funding is issued until this deliverable first draft is due is a little bit less than 5 months. In terms of formatting guidelines, we'll provide those to you. The double-spaced report is similar to what you've experienced in the past, and then we will also provide a template for the project brief as well. And then in terms of some other key dates, we will have one internal meeting where we'll have the opportunity for to discuss and feedback on your reports or project briefs with some of the reviewers and as well as representatives from the National Hazard Center and the CDC. And that's scheduled for May 2nd, 2023. And then finally, we'll be hosting a public webinar on August 3rd, 2023, where you'll have the opportunity to present your research findings or project findings to the public. So some key, excuse me, some key considerations. So your proposal should have a really clear and feasible timeline. As I mentioned, it's really a condensed timeline as you've experienced in the past that really outlines all your project procedures and meets the required deadlines. And given the short time frame, we realize that researchers may actually need to begin their project activities prior to funding being issued, particularly if you're continuing as part of track 1, your research, and you need to submit an IRB amendment. This might delay the time the funding is actually issued. So just please make make sure to plan ahead and submit everything as quickly as possible, knowing that those could potentially delay the funding. Also, as with our previous awards, the lead investigator must be part of an academic institution based in the U.S., a state, territory, or tribal area. Other team members, can come from other backgrounds, but at least the lead investigator must be associated with a U.S.-based institution, academic institution. And then in terms of distribution of funding, it can be distributed up until 5 different people who can be, the principal investigator, co-leads, project assistants, et cetera. And once all the IRB approval and other agreement documents are submitted, the payments will be sent directly to the award recipients. So again, like we've done in the past, it can't go to your organization or university. It has to go directly to you, as we do not fund overhead. I'm now going to hand it over to Megan, who's going to present on some examples of research activities and tips for strong proposals for both track 1 and track 2.
Thank you, Rachel, and thank you everyone who is here today. So as Rachel said, I'm going to go over some examples for track 1 proposals first. Just so you know, these are just some ideas to get you thinking, but we're not limited to just these examples. So if you have other ways that you are thinking about expanding your data collection or analysis activities, we're open to that as well. So some examples are, you could think about expanding your population of interest. So for example, if you were only focused on adults, you could look at children. There's other ways you can define how you want to expand your population of interest. You can also expand the geographic scope, either comparing new communities within the given territory where you were based originally, or comparing across US territories, or between the US territories and the US mainland. You can think about collecting new or more granular data using existing or new measures, conducting sensitivity analysis, increasing your sample size to enhance statistical power, engaging in additional longitudinal data collection, methods to follow up over time, and then developing perhaps maybe some community-based research instruments that you want to use to gather new data. Okay. So for some tips as far as what we're looking for, in the proposals that are submitting, the ones that we are going to prioritize are those proposals that are focused on producing actionable results, right, that can inform the evidence base and improve public health disaster preparedness and response. So we're prioritizing quantitative, applied, and evaluation research, but we are open to other types of research as well. We also are looking for proposals that are utilizing a social determinants of health perspective or a health equity lens. We have resources on our website. If you are unfamiliar, you should have, most of you who have submitted proposals before have used that lens in our previous award. So if you don't know that, we can provide you some links on the website for some guidance. We're also really interested in projects that are engaging with public health departments and other organizations. You all have been working on these projects, so you probably have those links, and we really want to hear about how you're engaging with organizations within your research site. We want research teams whose members have a strong history of working in the area. All of you pretty much have that right now. And research activities that enhance the rigor of past research through methods such as advanced sampling and analysis techniques. Okay, next slide. So for track 2, these are the community engagement. This is a community engagement and stakeholder engagement track. We're looking for, these are not projects that are going to be enhancing their data collection. So it won't include any new data collection or data analysis, but rather engaging with your community partners or other stakeholders. There's multiple ways you can do this. Like I said, this list is also just a list of examples. If you have other ways that you're thinking about doing it, we're open to that. But some examples are developing community-based interventions. So you would work with a local public health agency or other organization to develop an intervention based on those findings that you had from your initial research project. You could also work with a public health agency or other organization to evaluate their services and to see if their services are meeting those population health needs identified in your original project. You could do a training, working with community members, training them on your research findings and their applications, or with other practitioners in the field, or develop an educational webinar, develop a website. These are kinds of other multimedia tools that can, reach that audience, your community audience. Okay, Jen. So what are we looking for in these track 2 proposals? We're really prioritizing proposals that are focusing on ways that to facilitate that dialogue and partnerships with those local community partners and members and other government agencies. Proposals that are thinking about how to educate and train community members are also of interest to us, and other ways to engage and work with training local practitioners to enhance public health preparedness and response. We really want the track 2 proposals to specify in their proposal measurable project outputs and outcomes, and think about how to maximize their reach throughout the project area. And then we want projects that are thinking too about how can we make this sustainable over the long term. Once our project ends, how can we keep those capacities that we have been building with our local partners going? Okay, so that's it for me. I think we can go on to the last slide. We're ready for questions and answers.
Okay, and I'm going to go ahead and stop sharing my screen so I can just see everybody here. There you all are. Wonderful. Okay, so I'm just going to start really quick by answering out loud Allison's great question that I answered in the chat box, which was she actually was on 2 different projects across the special calls, and she asked if she could receive money since it was 2 distinct projects from if she submitted 2 proposals. And so my answer is really just that even though it was 2 separate projects, both of those project teams could submit a proposal for new funding for the continuation award, but her as an individual would only receive funding from one of those, so only be written into the budget on one of those, but could be included as an author. And that's just for fairness across all the different authors in terms of the distribution of funds that we have available. Okay, anybody else have a question? And there's not very many of us on the call, so if you want to come off mute and just ask your question or raise your hand. Oh, Michael, I see you have a question.
Yes, I'm part of a team that did some work in Puerto Rico on data gathering, and we're interested in doing a type 2 proposal where we take our results, talk to the community and try and put them into action. But the timing's not good. They've just been hit again with another hurricane. They're not able to produce a proposal in time for your deadline. And also, even if we could, I don't know if we could implement it given how things are over there. So should we wait for next funding cycle, or can we delay?
Thank you, Michael. That is a really good question. And I'm I'm so sorry that we can't delay all of the due dates for everything, even though this event has occurred, which is very untimely and not convenient at all for all of the researchers, of course. But we are under strict deadlines from the CDC that we have to meet in terms of the award funding that comes to us. We have to pay it out and we have to have the deliverables met by a certain date. That being said, if you do have a research project that you think is feasible in terms of completing the research, but maybe the proposal, you can't get it completely built out in time with all of the details, we do suggest that you submit a proposal on time, but maybe you have placeholders for things that you maybe can't get all the information you need. And we can have a little bit of flexibility around that first proposal date, and then maybe even when that first report is due, but only within like a couple of weeks of wiggle room. There's not a whole lot of wiggle room, but of course, we're going to work closely with anybody who needs that additional support if you think that the research can actually be carried out in the time frame that we have listed on the website. Great question.
And just really quick, I'd love to follow up with Michael. Since again, we're benefiting from having a smaller group. Michael, since you really mentioned the interest in the track 2 proposal and the intervention, and even feeling like the intervention or application may be very difficult to achieve given the incredible devastation caused by Fiona, I wonder if you might be willing to share with us just kind of even any preliminary ideas of what were you and the team thinking of in terms of the potential research application over this next year? Because again, that might help us to think about, as Jen said, where can we be flexible?
Well, as you know, we worked with 2 organizations in Puerto Rico, and what we were planning to do was, or thinking to do, was go back with our results and our conclusions about what we thought should be implemented and get some feedback on that. Right, and see if it's viable. Also, what we thought would be the case, they'd be very much on people's mind at the moment, and that therefore we could work with them to develop strategies to deal with the health implications that we identified, you know, sort of the mental health, physical health implications. That's what we're thinking. But unfortunately, and what we were planning was to have with the University of Buffalo here, we were planning to have the University of Puerto Rico team members take the lead since it's in country. But of course, we got an email from them this morning that they don't have electricity, they don't even have an internet, and they just couldn't possibly get anything done in the time, you know, given the way, also they're helping other people out. So it's a little bit difficult for them, but that's our situation.
Yeah.
Thank you, Michael, very much. And we are definitely collecting everything that's being said here, and we'll talk to our wonderful funders and colleagues at the CDC who are incredibly sensitive to this situation. So just thank you for sharing that, and duly noted. Thank you.
Yeah, and I do want to say that we absolutely support the, you know, being ethical and not burdening these communities that have been so hard hit, and these organizations and local community members and everything. So we completely understand the challenges that everyone's facing right now. Gabriella, did you have a question?
I'm actually in the same situation as Michael. So my colleague is joining via phone from Puerto Rico, but is unable to participate in the drafting of the report because there's no electricity. And, you know, and at this point, actually, they're working on trying to even support community from their universities by providing just very basic access to, you know, sanitation, water, and so on and so forth. So while this is really important in terms of our findings, which found that gender-based violence supports aren't being provided to, you know, at points of disaster, right? Even though this is a very large and important problem in Puerto Rico, you know, we're not able to put something together, particularly a proposal that is robust, that actually, in our case, my colleague Waleska Sanabria would have been the lead on this because she's in place, and the area that we particularly studied is the most impacted by the hurricane. So we'd love to continue to do the work that we were doing, but we just can't possibly put it together like a large proposal as has been asked. We could do like amended extension to the original proposal, but to start from scratch again would be unfair because it wouldn't actually properly include our colleagues who are on the ground.
Thank you, Gabriela. Yeah, that is definitely a challenge. And like Lori said, we'll definitely continue to think on this and see what we can do in terms of flexibility. But I do encourage you, all of you that want to submit a proposal but don't have the time or capacity to connect with your partners in the way that you would like to for it, submit even just a short document that describes your situation and what you hope to do, and then let us at least have that and review that so we can take account of it. I mean, we can't make any promises that it can be funded without more information, but at least that'll keep a placeholder for you and give us some information of what your plans or thoughts are around the work that you want to do.
Yeah, Jen, I just wanted to add there too, both Michael and Gabriela and anyone else who is in this situation, please email us and let us know what's going on, and we will follow up with your specific case and your situation and give you some ideas and advice about the type of proposal you can submit, okay?
Yeah, thank you, Megan. Okay, other questions? I see there's a follow-up from Allison. She says, since only one team member needs to be from a previously awarded team, can up to 4 additional team members be new, unrelated to the prior research? Yes, as long as the lead or one of the people on the new proposal team is from a past call, you can have new partners join you on your proposal. Okay. Other questions?
Hi.
Hi, Diana.
Hi, how are you?
Good.
I'm kind of resounding on the other two on a Puerto Rico case, and I wanted to highlight or ask about the timing of the actual implementation of the project. So, because the last time we're starting at December and kind of getting is the timeline the same, or is there gonna be, just as a follow-up as well, on some flexibility on that implementation, or how much flexibility do you have given the case of Puerto Rico situation?
Megan or Rachel, do you want to take that?
Sure. Are you thinking of doing a track 1 or a track 2, Diana?
A track 2.
A track 2.
So I'm in the same board as Michael and Gabriela, because I think that for our case, it really made a lot of sense to go to the communities that we already had established from the focus groups we did, and kind of making it feasible for this community. So this communities, it kind of more of a participatory research, a kind of project. So it really is all about them, which is really the interest of us in that sense. We also, remember, we also collected data, but we are really interested in getting those public health implications and how communities will play a big role, because that was one of our findings, play a big role in that.
Okay, so I'm going to repeat again what Jen said, is we have limited flexibility as far as the report or the brief due date, as far as that part of it. But because you're doing this track 2 type proposal, right, which is, and it's participatory, and you're working with the community and you need to build those links, we can work with you, right? Email us about your situation, tell us a little bit more what's going on. We need to get as much done as you can in that period so that you can write a preliminary report, a preliminary project brief in your case. But you know, if you're still building those links and stuff and there's a phase of the project that can get done first, that you get us the information about, then maybe we can think about staging it kind of, you know, a little bit that way, but just kind of a case by case basis. Does anybody, Jen or Lori, does that sound reasonable given the situation?
Thank you.
Yeah.
I was just going to follow up too on a really good question that Allison wrote in the chat about she said, since only one team member needs to be from a previously awarded team, can up to 4 additional team members be new or unrelated to the prior research? And so one point of clarification that is absolutely, it is absolutely fine in these new proposals to bring in new people, because this is right, the track 1 or the track 2 may require new voices, new perspectives, new expertise, and just given the rapidly shifting dynamics in these contexts, may require new partnerships for that reason. And so absolutely, Allison, it's a wonderful question, but one thing we do really want to clarify is that it's not new research, so to speak, that it really is a continuation of what you were already doing. And so that hopefully we are hearing these questions so loud and clear and are so empathetic to everything that we are hearing, and just really want to underscore, we are not expecting like some brand, and in fact don't even want some brand new sort of, I did X and now I'm doing A, B, and C over here. We really want to see that continuation of your initial ideas. And again, this support came through because the initial work that you all did was so powerful and so important. And we also recognize that a year, really less than a year, sure isn't a lot of time to get the level of research and or the level of impact that we know that all of you wanted. And so I think what's already coming out of that call, like this call, continuity, focus in terms of the time available, and making sure that the rapidly shifting dynamics are also being taken account of, and knowing that on the flip side, we're going to be taking account of that too. Thank you.
Yeah, and to follow up with Lori too, we want to see, like, we want to fund whatever is possible with what you can do. We're not asking you to do this, huge, big thing with the time you have. We understand the limitations of time. So maybe apply for something that actually is very feasible in this short time window. And it might just be a first step of something else you want to do. But we're not expecting it to be a very grand, undertaking here for the amount of money that's being given to you. We just want to see you be able to continue the work that you were already doing.
And I think too, this is such an opportunity. I mean, we're always faced with this, with doing quick response research, but given the cascading and layering of disasters in the context where so many of you are working in your proposal too, this might be an opportunity to maybe have a couple of contingency plans. And so that space gets used with, because you're going to have to, as you all are already noting, you're having to think through this already. And so maybe it's sort of like, under the ideal circumstances, if our partners get power back on and are back available, this is the intervention that we were planning on conducting and engaging in over the next 5 months. However, if they continue to be in emergency response mode, which is very possible, this is the next contingency or the next option, which is we will lay the groundwork to do the work when they move out of this emergency period. And so maybe just kind of thinking about using the proposal also to do some of that contingency planning, if that makes sense. Thank you. Because we again hear you and feel you.
I just wanted to add to the link that Megan shared in the chat. So there was a question about whether we have guidelines, how to write the continuation award. And so, the proposal itself doesn't look so dissimilar to things you've done in the past, despite, if you are a different track, you talk about the expansion of your previous research. And so if you go to the links to the various tracks, it tells you basically all the different headings and what we expect from you in order to write the 8-page proposal.
Any other thoughts, questions, points of clarification? Oh, thank you, Kula. She asked where the template is for the project brief. We're still developing that template actually, so we don't have it quite yet, but that is something we will share with you. And really, it's going to be like a 2-page, probably not more than that, maybe 3 project brief. So it is going to be brief, and it really is just about a way for you to, creatively articulate what it is that you were able to complete in the community that you were engaging in that track 2 work in. Because there are a variety of different types of engagement work that you can do. And so it's just a place to kind of represent that. It might be a website, it might be something else you're doing, but it's just a little brief about what you did.
And Kula, and hi Kula, thank you for joining. Since you asked that really great question, one thing I was thinking about with the project brief is sort of like when you present and people go, oh, how did you do that? I wish I could replicate that in my community. And so sort of thinking about the project brief as a way of sharing. So for example, if you made a website to share what you learned about worker burnout in the USVI, and it would be a template that was really sharing like, here's the process we went through to build the website, to launch the website, to make sure the website's launching or reaching the desired population. Or if Samir had a series of community engagement meetings based on the research that he and his team engaged in, sort of a template for how did you do those meetings, what did they look like, and so forth. And so that's kind of the project brief, is thinking about how can we share these really neat, creative, important, and impactful interventions that so many of you are coming up with in these different contexts. Thank you.
I actually have one question. And just to start, our team shares in a lot of the concerns and challenges that have been raised earlier. We have one collaborator from the USVI that may be interested in partnering in some of this research, although, of course, our proposal focused in Puerto Rico. So when we speak about expanding the geographical scope, so for example, different communities, would it be acceptable to expand to a different territory, like the USVI, for example?
You're gonna take that, Megan?
Oh, yeah, that would be acceptable. That would be great. Yeah, definitely. I think we had it listed as part of one of the examples that you can expand to, other communities in Puerto Rico, other US territories, or compare between the US territories and the mainland.
Great, thank you.
Yeah.
I'll follow up. There's one more actually. So, I heard the words feasibility and what's possible in this kind of context. And I think that's a really important thing to say, given the situations that are currently unfolding. I'm trying to understand a little bit, what's feasible, but what also may be acceptable from a funding perspective. So for example, one idea that we have is to kind of roll out a survey or create the survey in the initial period of time. And when it's acceptable to do so, both by IRB standards, by our standards, and of course by the community standards, roll that out within the community that we've partnered with. That's very kind of small scale in nature, but we could make the case that it has a much wider impact and can link to broader aspects of our research program and the community's interests moving forward. But again, I'm kind of thinking like, the extent to which that would be viewed as enough, but also recognizing that we do need to privilege what's possible and feasible right now.
So Samir, you're asking specifically for the survey development would be the activity that was taking place in this time frame, right?
For the initial time frame, I think we would be interested in rolling that out, but that likely wouldn't come until next year. Early point of next year. So something that we could report in the preliminary report would be initial findings from that survey. But my broader question is the extent to which a survey in and of itself that builds on some of the research we're doing would be seen as doing enough in the scope of the grant, while also recognizing that any work we do now needs to be very sensitive in nature and be possible and feasible and wanted by the community.
Right. Lori, do you want to answer that one?
Oh, Samir, that is such a beautiful articulation. And I have to say, not only with the possibility for geographic comparison, the sort of embeddedness of the survey at the multiple layers that you just described, I think absolutely this fits within exactly what this continuation call is designed to do. And I have to say, as you were speaking, I also think there's such a paper in there, maybe it's a collaborative paper with 22 of us on this call to write, that is about these broader ethical considerations, as you're exactly articulating of what research do we do, when do we do it, how do we do it, and so forth. And I have to say, with all props to the CDC and with Rachel Adams, who led this effort, they funded us to create an entire module that's on these broader ethical considerations that are so far beyond the IRB. And so, Samir, maybe that is something to think about too, that you are thinking deeply about these ethical considerations. There's a reason why you're not just going to throw a survey out there into the world in the next 2 weeks, whether you have it created or not. And so maybe there's something in there to think about just even the dynamics of doing research. How do we do it? When do we do it? Why do we do it? And with whom do we do it? Were all questions that were embedded in what you just said so beautifully. So just, something else to think on. But in short, yes, absolutely. What you just said, I think, is perfectly aligned with both the time that we know you have available, but also the broader vision for this continuation call. Thank you.
Thank you, Lori.
And also, since we are such a small group, and like Samir just asked a really great question about his own research, if anybody has any questions they want to ask or just throw ideas out about things you're thinking about conducting research on or continuing your previous research or doing engagement activities, feel free to ask those as well. So I think we can all learn from each other in this way too. Lori, do you want to take Allison's question?
And Allison says, so are you saying a kind of meta exploration of research post hurricane with Fiona as a case study could be in alignment with the intention of this award? Again, it is a continuation of earlier research, but because so many of you were focused on, of course, cascading, compounding disasters, that I think if there's a way to keep that red thread from your earlier, and for you, Allison, projects, plural, there's got to be that thread that's tying together the earlier project with the subsequent proposal. But I think so many of you are positioned to move that forward, but then also remembering that really concrete, coming back to what are the public health implications of this work? How can we ensure that this really does have an impact on the ground? So I think yes, and Allison, it's that yes, and thank you. I wondered, since Gabriella and Waleska are both on here, and I don't want to put either one of you on the spot, and Waleska, I know you're on the phone and having power issues and so forth, but Gabriella, to the question you raised earlier, what based on what you've heard today about potentially getting the proposal in, but maybe with some of the contingency plans or so forth, Gabriella and Waleska, is what you're hearing sounding more feasible? Is there something that you're still feeling like in order to get this in by the deadline, we're going to need to think through A, B, and C on our end? Could you maybe just let us know a little more? Because I know Rachel, Megan, and Jen and I are going to need to walk away from this with a little time to debrief as well.
I don't know if Waleska can unmute,
Yeah.
but I think that's why we were thinking about track 2, because track 2 might be a little bit more feasible, and also the ethics of starting new research when that was something that maybe that would be, you know, not taking into account what the communities are going through. So and then also the urgency of trying to actually provide something that's supportive. And so there's the, what is supportive long-term for public health? This is what I'm thinking about. What's supportive long-term for public health, right? And the immediacy of the emergency as well. So I think that's partly what's confusing my thoughts as to what we should go for in terms of that tier 2, because there are definitely immediacy. So for instance, from our research, we know that older persons, and particularly older women, are going to be particularly vulnerable. So we could take data from our research and actually see if we could talk to public health in Ponce and see how we might be able to support them in thinking about how to support older women who are caring for people with disabilities, which was a group we identified as particularly vulnerable. But is that, do they really want to hear from us right now? Right? Are they dealing with more immediate needs, right? So if we were to orient it towards that. And so thinking about kind of an intervention where we wouldn't be interfering with people's emergency work. That's the thought I've been having in terms of trying to figure out what we might propose. And so in some ways, the immediacy of the situation is making it even really hard to decide which direction, because there's multiple directions in the findings that we had in our research. I'm sure that's the same for Diana and Michael as well in their projects. But those are just the quick thoughts I've been having in terms of trying to even narrow it down to which direction.
Thank you. That's very helpful, Gabriela. And I think that gets at the kind of contingency plan that's right. It's I'm really hearing you about it. May not even make sense to sort of do the reconnaissance to ask what feels most useful over the coming weeks because of people being in the emergency period. But maybe if it's possible to use that proposal writing to come up with, again, contingency plan 1 is if the groups with which we're working want X, then this would be our X intervention that we put in place. If we're able to ascertain from them that they would want Y, then we would do Y. And so I think that gets at that contingency possibility for the proposal. Thank you.
Okay, anybody else have thoughts they want to share or anything they want to say? Okay, well, if nobody else has any additional last questions, thoughts, please do know you are welcome to email us at any time. Tell us about what's going on with your research. If you have questions, if there's ways we can help you, please feel free to email us at has.research.awards@colorado.edu. And thank you all so much for taking the time to be here today. We really appreciate it. We will, this is recorded. We'll post it back online, like I said, on that continuation award page. And so if you have partners that want to watch this that weren't able to join today or other people who couldn't be here, please feel free to share that link as well. Yeah, and we look forward to seeing proposals or hearing from you soon. Bye, everyone.
Bye. Thank you.
Thank you.